Okay, Doc, now we're moving on to immunology. And I bring this up because we have to be careful. There's a lot of information in immunology you have to cover, but once you can grasp 65% of the knowledge and work on test taking skills, I promise you, you'll definitely bump up your score on the step one exam. So I chose this specific one because it's a little tricky. And again, not every question is the same, but they love using the similar format, similar ways of tricking people, tricking us. So you have me to navigate you through all this. Okay, so let's begin. Last 2-3 lines first, always remember, last 2-3 lines. Examination shows a generalized erythematous, scaly rash, and white patches on the tongue and buccal mucosa that bleed when scraped. The remainder of the exam shows no abnormalities. Okay, that's good. X-ray of the chest shows bilateral interstitial infiltrates and an absent thymic shadow. Which of the following is the most likely cause of the patient's condition? So there's two conditions that present with absent thymic shadow. I want you to think about it. I want you to open up your first aid if you need to and start really dissecting the content, because there's B cell disorders, there's T cell disorders, there's B and T cell disorders, and there's also phagocytic dysfunction disorders, right? Phagocytic defect. So when you see absent thymic shadow, automatically you're going to think DeGeorge's, and chromosome 22 is DeGeorge's. I can guarantee 52%, if not a little less, a little more, answer this question. Now, at the same time, I want you to say, okay, there's two conditions that present with absent thymic shadow, meaning they don't have a thymic shadow. One is DeGeorge's and one is actually SCID. So I just gave it to you. DeGeorge's and SCID. Okay, so you need to go one by one and say, well, now that you have an idea of which ones have no thymic shadow, then you have to go down and you have to choose the answers to eliminate the ones that you know are not possible. So this is DeGeorge's. What is this one? NADPH oxidase deficiency. That's CGD. Integrin beta 2 defect. What is that? That's LAD. WAS, well, that's WAS. This is the easy ones. I love when the name is in the name. And interleukin 2 receptor gamma chain defect, aka SCID. So you need to know some information, obviously, because we need to know the basics in medicine to then eventually use our test taking skills to really master the content and the exam. So being that it says absent thymic shadow, majority of us jump to DeGeorge's, boom, click, and it might be right, it might be wrong, we will see. But what we can do is knock out the ones that are not possible. So CGD is out, LAD is out, WAS is out. We're down to 2. Now, we have to go to the top and read the scenario to figure out, well, what else is the patient going to present with? And whatever they're presenting with, does that fit either DeGeorge's or SCID? Let's continue. A 6-month-old boy is brought to the ED because of fever, fast breathing, difficulty feeding for 2 days. His mother reports that he has had recurrent pneumonia, has been hospitalized for severe dehydration, secondary to acute GI stuff, caused by rotavirus infection 3 times in the past 4 months. So he has bacteria. He has virus infection. His both height and weight are third percentile. So that's the whole failure to thrive. So when you hear failure to thrive and you see failure to thrive, that's what they're talking about. So you have bacterial infection, you have virus infection, and further down, you have white patches on the tongue, buccal mucosa. You think it might be candida. So fungal infection. So hold on a second. You have bacteria, viral, fungal. Now, does that fit the criteria to diagnose DeGeorge's? Can you give the patient or the patient's family a diagnosis, say, well, your little boy of 6 months old, we think he has DeGeorge's. Well, think of what DeGeorge's presents with. It's a pneumonic catch-22, right? They're going to have cardiac anomalies. They're going to have low calcium hypocalcemia, which causes tetany. And they have issues with the heart, right? Arrhythmias. So, and also other issues in the facial region, right? Defects. So being that that's the case, do you see that in the scenario? No, you don't. Because you don't see it, this can't be the answer. So this is out, and by default, this is the answer. Now, 50% of people, all your friends, colleagues in this country, all over the world, they're using Amboss, choose this. And now I know you know why because as you watch our videos and I navigate you through this content, you can clearly see people jump too fast. Just like if I told you, hey doc, this person that I just saw in the room, this patient lost 20 pounds. Oh, cancer. Wait, hold on. The 20 pounds that he lost in 7 months. Well, that's not cancer. Versus he lost 20 pounds. Well, how long, Dr. Stavros? Well, in about 3 weeks. Well, that's a problem. And he wasn't really meaning to lose the weight. So you see, it's all in the details. And that's why if you read the scenario, and I always tell you, read the last 2-3 lines, but I never tell you just read and go. Read the last 2-3 lines to understand what they want from us, perhaps some valuable information, and the valuable information it was absent thymic shadow. It provided us 2 different differentials, DeGeorge's and SCID. Thereby, we went ahead, knocked out 3 answer choices, B, C, D, left with A and E, and we had to go to the top, always go to the top and read the rest of the scenario, presenting bacterial infection, viral infection, and fungal infection automatically leads to SCID, knocks out DeGeorge's. But if you don't watch these tricks or these sand traps that they put into these scenarios, you will be one of those of the 50% that will hit the answer move and be happy that you chose it right. Be happy that you got the right answer. In reality, you didn't get the right answer. So be very careful and cautious. It's very advantageous to read all this information here. You always hear me say it video after video. You have to take your time and read the scenarios, guys, and read the answer choices. Because in this case, it's going to talk about SCID. And then if you open up the first aid, which I hope you have opened up right now, you will see the different conditions. And please, just like pharmacology, when I ask of you, can you differentiate? Can you at least class the drugs? Same thing here. If I give you a list of 4, 5, 6 diseases, can you tell me which ones are B cell disorders? Which ones are T cell disorders? You have to do that. If you don't, they'll give you something so simple in a scenario that's going to literally be a B cell disorder, and you won't know how to differentiate them in the answer choices versus a T cell versus both versus some issues with the phagocytic dysfunction. So I promise you, if you take your time and look at those charts and attack it like I've told you how to attack it, you'll be able to answer the questions a lot better. Points of entry again, absent thymic shadow, 2 conditions, SCID versus DeGeorge's. Before you jump, go to the top, figure out what condition, what symptoms they're presenting with. Does that fit the criteria for either differential? Go below, hit the answer and move. And I promise you, take your time, read the other answer choices, and push hard with this, because when you read the other answer choices, you'll be able to absorb what the other answers have to offer, why it's not CGD, why it's not WAS, why it's not LAD. And then later down the line, when you get more questions like these, which you will, especially if you're still practicing, when you're using AMBOSS versus UWorld, you'll be able to appreciate more of the findings, okay? So take your time with it. Don't jump too fast. If you do jump, because I used to jump as a med student, take a deep breath. Say, all right, Dr. Stavros said, before I move on to the next question, if I think it's DeGeorge's, that's fine. Read the scenario, and does it fit DeGeorge's symptoms and signs? Do you see catch-22 symptoms and signs? If you do not see any of that, it cannot be DeGeorge's. But thereby knock it out, hit the bottom answer, and move. All right, Doc? See you in the next question.